Medical Mercy Canada has been caring for and sharing with the people of Western Ukraine for 25 years. Over the years, our projects have included 59 village medical aid stations and clinics, 4 hospitals, 28 schools, 15 child care centers, 8 geriatric care centers, 1 adult tuberculosis center, 1 orphanage and pediatric tuberculosis center, 2 disabled children's centers, and 1 family support organization, Ukrainian Rodina. Time and political instability have led to deterioration of healthcare and educational facilities throughout rural Ukraine. Due to this neglect and disrepair, all of these facilities have suffered interior damage due to leaky roofs, broken windows, doors, and floors, and inadequate heat and water supply. Since the early years of MMC in Ukraine, this was brought to our attention, and we have been helping the people of Ukraine to repair their own facilities.
All medical and educational facilities have had outside toilets, which are unstable and unsanitary. MMC's priority is to improve sanitation and health by installing indoor toilets and wash areas.
Nearly all medical and educational facilities require new equipment. Currently, equipment dates back to the 50s, and much of it is non-functional. Medical supplies are very scarce in rural areas. The nurses plead with us to send them simple supplies such as bandages and sutures. Our donated medical supplies help nurses and doctors to treat their patients.
Walkers were unheard of in rural Ukraine before MMC arrived. Now these walkers have provided independence for disabled villagers and seniors.
When MMC first arrived in Ukraine, geriatric care centers did not exist in rural areas. MMC has and still is renovating 8 geriatric care centers to provide appropriate surroundings for seniors to be cared for and live with dignity. Child care centers enable both parents to work outside the home in order to provide adequate support for the family. Even with 2 incomes, most families still struggle to survive. The child care centers all required extensive renovations before they could be safely used.
Schools are a vital part of every community. The school, however, must be a healthy place for students and teachers in order to function properly. If it is not, then the entire community suffers. MMC strongly encourages and supports communities to renovate schools by funding the replacement of roofs, windows, floors, and doors, fixing heating systems, and installing septic systems and indoor washrooms. A safe, warm school is a healthy and much more effective place for students and teachers.
From Dr. Donna Taylor. One evening we had a call that a lady had fallen and had lacerations on her head. We decided to accompany the local doctor for this house call and gather some supplies from our suitcase, as the doctor did not have any. When we arrived, we saw an elderly lady lying on her side. There was a cut above her ear which went through to the bone. We took her back to the doctor's office, put some anesthetic on her wound, found some non-sterile gloves, and sutured the wound without anesthetic, as there was none available. Without these supplies, this patient would run the risk of infection or the high cost of the family renting a car to take her to the hospital an hour away, which most families do not have the money for. On another occasion, we were called to a house of an elderly man who had fallen and had a deep laceration on his shin. The skin and tissue was peeled back from mid-shin to ankle. This time, there was unfortunately no sutures available, as we had used them all previously, and the man had to wait and go by ambulance to the local hospital. In Canada, where such basic medical supplies are always available, we never stop to think of what the impact would be of not having these for our patients.
This year, there was a diversified team of 8 people. The Semkoles have been leading missions to Ukraine annually for 25 years. Returning team members have come to know the challenges of the people in villages of Ukraine and the neglect shown by their government. Hugs from team members and support from MMC develops relationships which give the people hope and encouragement to keep working to create their own healthy communities.